What's going on, everyone? Welcome to our first episode of Tackling Mental Health. I'm Torrey Smith, your host, here with Matthew Peters, Associate Professor at Johns Hopkins and also the Chief Medical Officer of Rose Health. Thank you for joining us.
Thank you, Torrey. Glad to be here.
Now, we were talking off air. You are a neuropsychiatrist.
Correct. Yep, that's exactly right.
You had to educate me on this.
Yeah, let me tell you what it is. So throughout my training, I went to medical school here in Baltimore at Johns Hopkins. Decided during that time that I wanted to specialize in the psychiatric presentations that were happening in the setting of neurologic disorders. So to break that down a little bit, individuals that have recurrent head injuries, strokes, tumors, encephalitis, et cetera, those are the patients that I treat clinically, both within the hospital setting as well as in the outpatient setting. The training for that involves 4 years of medical school, 4 years of residency, 2 years of fellowship, and then I came on faculty at Hopkins after that.
So what made you decide to go into that field?
Yeah, during medical school, we have the opportunity to explore essentially all the fields of medicine. And it was during my rotations in psychiatry that I realized that there was a real opportunity to be a true leader in that field and make a difference in the lives of patients. If you want to talk about patients that feel disenfranchised, these are individuals that have been handed off by other elements of medicine, and once they get to my clinic, my hope is that they finally found a place that offers them hope and that they get the treatment that they actually need. And the good news is that most of them get better once they found that care.
Now, I feel like the climate that we're in right now, especially due to COVID, has really highlighted everyone's opinions and thoughts and really their care about mental health. You're talking about really unprecedented times for us, especially in this country where we were literally shut down. What are some of the things you've seen people do, and really how has it helped your work because of it?
Yeah. COVID has made a giant influence. There has been some silver linings in that the use of technology to deliver healthcare has really taken a generational leap forward. I think what most people will realize is that virtual care or having visits with your providers through telemedicine, through video conferencing, has really become something that's both reimbursable but also commonly used.
So you mentioned access with mental health and obviously how technology plays a role in that. You're very familiar with Rose's technology.
Yes. Yep.
How do you think Rose can really change the way people have access to mental health care?
Yeah, sure. That's a great question. So at Rose, what we are really trying to do is augment the excellent care that people are already delivering. In no way are we trying to replace care. The idea is really, how do we deliver the right care to the right patients at the right time? And that's what I tell the team over and over again needs to be our goal. There are patients that truly need a specialized level of care, and if we can identify them and get them to the right providers, that's a win. There are other people that could be safely managed within, let's say, the primary care setting, and we want to empower the primary care providers to be able to do that. So put simply, our software package, what it delivers, it's an app-based for the patient, a web-based for the clinician, and it really connects them both before the visit as well as that gap between visits, while at the same time offering self-help tools back to the patient. So the providers are more educated on what the individual is going through, and the patients themselves are receiving curated, automated self-help tips so they can take some of their care into their own hands. Unfortunately, there's a deficit of around 100,000 mental health clinicians in the United States alone. And just to fill you in, the amount of training that it takes to become one of those specialists is pretty vast. And so just all of a sudden having 100,000 more people that can provide that care isn't going to happen. So we need to, again, rely on our primary care colleagues, rely on individuals that can help us in battling the mental health crisis, so that the patients that make their way all the way to me and to the clinics like the one I work in, they're the ones that really need the care the most. Because those patients with severe illness oftentimes are the ones that really can't advocate for themselves.
Does the Rose app have anything that can connect someone to a therapist or a psychologist that they believe that can help them?
Yeah, absolutely. And that's been a really exciting part of what we've developed over the last year. Access to mental health care is a major issue. We already highlighted that earlier. But what we're trying to do is we're trying to help people get connected to the right therapist or the right practitioner the first time. So we've been able to partner with a leading organization that does care coordination or care navigation, and they are a big part of our platform now and are able to help connect that adolescent user or adult user to individuals that can actually provide them that care.
As we begin to wrap this up, I want to know, what are your personal goals in terms of helping to change the narrative about mental health, but also to make sure that access exists across the board?
Yeah, thanks for asking that. It actually has been a huge part of my career to create scalable solutions that are technology driven. And part of the driving force behind that is that I grew up in a really small town in Pennsylvania. There's not a single mental health provider in my entire hometown. And what my parents would like would be for me and my growing family to move home. But right now, that's not necessarily an option as my wife and I grow our careers and our family. So I have made it a mission to try to create these solutions that you don't need to end up behind the walls of an institution like Johns Hopkins, where I work, to get excellent care. You can get it no matter where you are out in the community. And the only way to do that, in my opinion, is you have to embrace the use of technology. You're not going to just replicate providers, replicate people. You need to do that through technology-driven solutions. And so whether it's my work at Rose or the work that I do at Johns Hopkins, it's really been trying to deliver solutions to anybody that needs them. And coming back to a term I said earlier, delivering the right care to the right patient at the right time, and we really do have an opportunity to do that.
Thank you. I've enjoyed the conversation.
Thank you for having me.
I appreciate you being here. Thank you guys for joining us. Catch you next time on Tackling Mental Health.